Hello, everyone. My name is Anthony Sloan. I unfortunately had a few falling outs with my interviewee, so I had to make up something last minute, so apologies. I chose to diagnose my patient with rheumatoid arthritis and the events that led up to the diagnosis. So, according to the clevelandclinic.org, rheumatoid arthritis starts around 30 years old, and they notice persistent stiffness in their hands, fingers, and wrists in the morning, chalked it up to simply being overworked, and over time the pain escalated. And after a particularly tough day at working, the patient started to experience abnormal swelling pain in their knees, which was peculiar that it just randomly arose, and a sudden lack of appetite, which prompted a doctor's visit. So after a few visits, they ruled out things like osteoarthritis and Lyme disease, and the final diagnosis that they came up with was rheumatoid arthritis. Symptoms that they experienced, according to the Mayo Clinic, symptoms of rheumatoid arthritis may include painful, warm, swollen joints, joint stiffness that is worse than the morning, lasts 45 minutes or longer, tiredness, fever, and not wanting to eat, peculiarly. And sometimes the pain and stiffness can extend to other bits and body parts, such as your knees, shoulders, back, and other areas of your body. In some cases, even skin, eyes, lungs, heart, and nerve tissue, and even blood can be affected. Tests and treatments for rheumatoid arthritis, according to Hospital for Special Surgery, ways to test for rheumatoid arthritis include blood tests to check for positive rheumatoid factor, anti-CCP antibody elevation, as well as sedimentation rate or C-reactive protein elevation. X-ray changes can also show a narrowing of joint space over time, so if you take X-rays over time and get them, they can kind of compare and contrast from each individual visit to see if that joint is narrowing, and that can confirm the presence of rheumatoid arthritis in all of those tests. Also, according to hss.edu, treatments for rheumatoid arthritis include simple pain medications like ibuprofen or other NSAIDs can help, and others, DMARDs like methotrexate, or surgery may be needed. Dietary changes can also help with some inflammation and fatigue. And the final prognosis for the recovery of rheumatoid arthritis. Rheumatoid arthritis is unfortunately a chronic condition, so it can never truly go away. According to nhs.uk, early treatment and support, which includes medicine, lifestyle changes, supportive treatments such as physical therapy, as well as surgery, can reduce the risks of joint damage and limit the condition. So nutrition changes and physical activity can also aid in reducing the symptoms, and in some cases they can make the symptoms end up feeling like nothing at all, so almost like a remission. Though technically it never truly goes away, with consistent time, patience, and consistency, there's a chance that the overall effects are going to feel next to none. Even though sometimes your fingers may get a little bit curved in or have a little bit of a bump, the feeling of pain will overall kind of be reduced. That's pretty much all I had. So thank you for listening, and I hope you all have a great day.